The Honourable Ruth Dyson.
Thank you, Mr Speaker. My question is to the Minister of Health. Why have there been numerous announcements of health cuts in the last 20 months if, as he said last week, the health budget in the last 20 months has increased by over $1.3 billion?
The Honourable Tony Ryall.
Mr Speaker, the member is correct that the health budget has increased by over $1.3 billion in the past two budgets, and we are getting more frontline services. Despite this increase, DHB still have to prioritise their spending as they always have done. And this is why under the previous government they closed the Fielding Maternity Centre, reduced home care in Wanganui and Otago, culled 30,000 people off waiting lists and reduced elective surgery at some DHBs.
Honourable Ruth Dyson.
If the district health boards are so awash with money as he says, why are frontline nurses and other health workers in Taihape being forced to take a 10% wage cut in order to keep their health centre running?
The Honourable Tony Ryall.
Mr Speaker, the government has never claimed that district health boards are awash with cash. The fact is we are coming out of one of the worst recessions since the 1930s, and the government has been requiring everyone to look for value for money and spend the $1.3 billion extra well. The Taihape Health Service is in serious financial trouble, and an independent report into its future has identified several things that need to change if it is to continue, and they are getting strong support in that from the Whanganui District Health Board.
The Honourable Ruth Dyson.
Is the option of frontline nurses and other health workers taking a significant cut in their wages an acceptable way for him to keep our health services operating?
The Honourable Tony Ryall.
Mr Speaker, the Ōtapi Health Trust is an organisation which is not owned by the government. It is funded by the government, and the conditions by which people are employed is a matter for the trust.
The Honourable Ruth Dyson.
Given his expressed desire to Treasury to be a more hands-on minister, why didn't he intervene and appoint a statutory manager to the Taihape Health Centre, as proposed to local Member of Parliament Simon Power, rather than washing his hands of involvement and allowing the workforce to be forced to take this significant pay cut?
The Honourable Tony Ryall.
Mr Speaker, I would just comment from that question. I think it's quite clear that the member does not have an appreciation for the matters that were happening at that private organisation at Taihape Health Trust. What we know is that an arrangement has come which should be expected to allow services to continue in that community.
Dr Jackie Blue.
Thank you, Mr Speaker. To the Minister of Health. What reports on frontline services for the thousands of New Zealanders who need access to medicines has he seen?
The Honourable Tony Ryall.
Mr Speaker, I'm able to report to the member that the government's $60 million boost to the medicines budget is benefiting over 250,000 New Zealanders. Pharmac has used the additional funding for medicines to introduce a newly subsidised medicines, including the first Alzheimer's drug, new diabetes medicines. Access has been widened for conditions including several cardiac and respiratory problems, depression, Crohn's disease and severe psoriasis. These patients could not have received access to these subsidised medicines just 2 years ago.
Question number 7.